Many people notice a surprising change in their body when climbing stairs. An activity that once felt easy suddenly becomes exhausting. Breathing becomes heavier, the heart beats faster, and there may be a sensation of pressure or fatigue in the chest. This change often happens gradually, which makes it easy to ignore at first. Shortness of breath during exertion is one of the most common early symptoms of cardiovascular problems, including heart failure. However, it is also important to understand that not every episode of breathlessness indicates a serious condition. The body's ability to tolerate physical activity depends on multiple systems working together, including the heart, lungs, muscles, blood circulation, and nervous system. When climbing stairs, the body suddenly requires more oxygen. Muscles demand increased blood flow to produce energy. To meet this demand, the heart must pump more efficiently, and the lungs must deliver oxygen effectively. If any part of this system becomes impaired, breathing may feel difficult. In early stages of heart dysfunction, symptoms often appear only during exertion. At rest, the body may compensate successfully so individuals feel normal. This is why early warning signs are frequently missed. People may assume they are simply out of shape, tired, or aging. Heart failure does not mean the heart stops working. It means the heart cannot pump blood as efficiently as the body requires. This reduced efficiency causes fluid to accumulate in tissues and reduces oxygen delivery to muscles during activity. The result is fatigue and breathlessness. Another factor is circulation efficiency. When the heart's pumping strength decreases, the body compensates by increasing heart rate. This compensation temporarily maintains blood flow but creates sensations of effort and exhaustion. The important message is awareness. A gradual decline in exercise tolerance should not be ignored, especially if it continues to worsen over time. Recognizing early symptoms allows earlier diagnosis and better treatment outcomes. To understand why shortness of breath occurs, it is helpful to understand the relationship between the heart and the lungs. These two organs function as a coordinated system responsible for delivering oxygen to the entire body. The lungs receive air and transfer oxygen into the bloodstream. The heart then pumps this oxygen-rich blood through blood vessels to muscles and organs. After oxygen is used, carbon dioxide returns to the lungs for removal. This cycle happens continuously throughout life. When the heart begins to weaken, blood flow through the lungs may slow down. This creates increased pressure in lung circulation. As pressure rises, fluid can leak into lung tissue, making oxygen exchange less efficient. Even small amounts of fluid can create the sensation of breathlessness during exertion. At early stages, symptoms appear only during physical activity because the body's oxygen demand increases. Climbing stairs is a particularly challenging activity because it combines vertical movement with muscle effort. The heart must work harder against gravity while supplying large muscle groups. Many individuals first notice symptoms during stairs rather than walking on flat ground. This pattern can be an important early clue. Another contributing factor is reduced muscle oxygen utilization. When circulation becomes less efficient, muscles fatigue faster, creating a sense of exhaustion that feels like breathing difficulty. The nervous system also plays a role. When oxygen demand increases rapidly, breathing rate rises automatically. This sensation can feel uncomfortable or alarming, especially if unexpected. Understanding the interaction between the heart and lungs helps explain why breathlessness can be an early signal of cardiovascular problems. One of the biggest problems with heart failure is that early symptoms often appear slowly and subtly. Because the changes happen gradually, many people do not recognize that something is wrong. They may blame aging, lack of fitness, stress, or temporary fatigue instead of considering a medical cause. Shortness of breath during activities like climbing stairs is frequently one of the first warning signs. At the beginning, a person may simply feel more tired than usual. They might notice they need to pause halfway up the stairs or breathe more heavily after reaching the top. Because the symptoms are mild, they are easy to dismiss. Fatigue is another common early symptom. When the heart cannot pump efficiently, muscles receive less oxygen-rich blood. This leads to a persistent feeling of low energy, even after rest. Some individuals describe this as a loss of stamina rather than obvious exhaustion. Another subtle sign is reduced exercise tolerance. Activities that once felt easy may suddenly require more effort. Walking uphill, carrying groceries, or climbing stairs becomes noticeably more difficult. Some people experience mild swelling in the ankles or feet, especially at the end of the day. This occurs because fluid begins to accumulate when circulation becomes less efficient. The swelling may disappear overnight, making it easy to ignore initially. Sleep disturbances can also appear early. Individuals may notice difficulty lying flat due to breathing discomfort. Some may wake up during the night feeling short of breath and need to sit upright to recover. The body often compensates for reduced heart function by increasing heart rate. This may create sensations of a faster heartbeat during exertion. While this compensation helps maintain circulation temporarily, it can also cause fatigue. Recognizing patterns is important. Occasional tiredness is normal, but persistent or worsening symptoms deserve attention. Early diagnosis allows treatment before severe damage develops. Heart failure does not develop suddenly in most cases. It is usually the result of long-term changes that gradually reduce the heart's ability to pump effectively. Understanding these causes helps explain why symptoms appear and how they can be prevented. One of the most common causes is high blood pressure. When blood pressure remains elevated for years, the heart must work harder to pump blood against increased resistance. Over time, this extra workload causes the heart muscle to thicken and eventually weaken. Coronary artery disease is another major factor. When arteries supplying the heart become narrowed or blocked, the heart muscle may not receive enough oxygen. Repeated episodes of reduced blood flow can damage heart tissue and reduce pumping efficiency. Heart attacks can directly injure the heart muscle. Damaged areas may not contract properly, reducing overall pumping ability. Diabetes also contributes significantly. High blood sugar levels damage blood vessels and increase inflammation, affecting heart function over time. Obesity places additional strain on the cardiovascular system. The heart must pump more blood to support increased body mass, which increases workload. Lifestyle factors such as smoking, excessive alcohol consumption, poor diet, and lack of exercise accelerate cardiovascular damage. Aging itself also changes heart structure. The heart muscle may become stiffer, reducing its ability to fill and pump efficiently. The important point is that many of these factors are modifiable. Prevention and early management can significantly reduce risk. One of the most important mechanisms behind shortness of breath in heart failure is fluid accumulation inside the body. To understand this, it is helpful to imagine how circulation normally works. The heart pumps blood forward through arteries, delivering oxygen and nutrients to tissues. After oxygen is used, blood returns through veins back to the heart and lungs to be refreshed. When the heart becomes weaker, this forward movement of blood slows down. Instead of circulating efficiently, blood begins to back up in certain areas of the body. One of the most sensitive areas affected by this backup is the lungs. The lungs contain tiny air sacs called alveoli, where oxygen exchange occurs. Oxygen enters the bloodstream, and carbon dioxide leaves the body during breathing. This process requires clear space for air movement and thin membranes for gas exchange. However, when pressure in the blood vessels of the lungs increases due to weak heart pumping, fluid can leak into surrounding lung tissue. Even small amounts of fluid reduce oxygen exchange efficiency. The person may begin to feel that breathing requires more effort, especially during physical activity. Climbing stairs increases oxygen demand suddenly. Muscles require more oxygen, and breathing must increase quickly. If lung efficiency is reduced due to fluid accumulation, the body struggles to meet this demand. The result is shortness of breath. Another factor is that fluid buildup does not occur only in the lungs. Fluid may accumulate in the legs, ankles, abdomen, or other tissues. This condition is called edema. Swelling in the legs is often one of the visible signs of heart failure progression. The kidneys also play a role. When circulation decreases, the kidneys receive less blood flow. The body interprets this as dehydration and responds by retaining salt and water. This protective mechanism, unfortunately, worsens fluid accumulation. This creates a cycle. Weak heart function causes fluid retention, and fluid retention increases strain on the heart. Over time, symptoms may worsen if untreated. Understanding fluid dynamics helps explain why breathing becomes difficult even when lungs themselves are not diseased. The primary issue is circulation efficiency. Shortness of breath during activities like climbing stairs rarely appears alone. In many cases, it is accompanied by other subtle symptoms that people may overlook or consider unrelated. Recognizing these additional signs can provide important clues about underlying heart function. One of the most common associated symptoms is fatigue. Individuals may notice that their energy levels are lower than usual. Tasks that were previously easy begin to require more effort. This is not simply tiredness after a long day. It is often described as persistent exhaustion that does not fully improve with rest. The reason fatigue occurs is closely related to circulation. When the heart cannot pump efficiently, muscles and organs receive less oxygen-rich blood. Without adequate oxygen, cells produce less energy, leading to weakness and tiredness. Swelling in the legs or ankles is another frequent sign. Fluid accumulation occurs when circulation slows down and pressure increases in blood vessels. At first, swelling may be mild and appear only in the evening after standing or sitting for long periods. Many people assume this is normal or related to aging, but it can also indicate early heart dysfunction. Some individuals notice weight gain over a short period of time. This is often due to fluid retention rather than fat accumulation. Rapid changes in weight should always be evaluated carefully. Another important symptom is difficulty breathing while lying flat. This condition is known as orthopnea. People may need extra pillows to sleep comfortably or feel relief when sitting upright. This happens because lying down allows fluid to redistribute toward the chest and lungs, increasing breathing difficulty. Nighttime episodes of breathlessness may also occur. Some individuals wake suddenly feeling unable to breathe and need to sit up to recover. This symptom can be frightening, but is an important clue for heart-related breathing problems. A persistent cough, especially when lying down, may also develop due to fluid accumulation in lung tissue. In some cases, the cough produces frothy sputum. These symptoms together create a pattern. Breathlessness, fatigue, swelling, and sleep-related breathing changes often appear gradually. Recognizing patterns rather than isolated symptoms helps identify potential heart problems earlier. When someone begins to notice increasing shortness of breath during activities like climbing stairs, medical evaluation becomes an important step. Many people feel anxious before seeing a doctor because they fear serious diagnoses. However, understanding how the diagnostic process works often reduces fear and helps individuals approach the situation more calmly. The first step in evaluation is usually a detailed medical history. Doctors ask questions about when symptoms started, how they progressed, and what triggers them. They may ask whether breathing difficulty occurs only during exertion or also at rest. Questions about fatigue, swelling, sleep position, and nighttime symptoms help identify patterns. Lifestyle factors are also important. Smoking history, alcohol consumption, physical activity level, diet, and stress exposure can all influence heart and lung function. Family history of heart disease may provide additional clues. After discussion, a physical examination follows. The doctor may listen to the heart and lungs using a stethoscope. Certain sounds can indicate fluid accumulation, valve problems, or abnormal heart rhythms. Blood pressure, heart rate, and oxygen levels are usually measured. One of the most common tests is the electrocardiogram, or ECG. This painless test records electrical activity of the heart and can reveal rhythm abnormalities or signs of previous heart damage. Blood tests may also be performed. Some blood markers help detect stress on the heart muscle. Other tests evaluate kidney function, thyroid hormones, anemia, and electrolyte balance. Imaging plays a major role as well. An echocardiogram uses ultrasound to visualize heart structure and pumping function. It allows doctors to measure how effectively the heart is moving blood. In some cases, stress testing is recommended. This evaluates how the heart performs during physical activity and may reveal problems not visible at rest. Chest imaging, such as X-rays, can show fluid accumulation or lung conditions contributing to symptoms. The most important message is reassurance. Many people fear evaluation, but diagnosis provides clarity. Identifying the cause early allows treatment before symptoms become severe. Medical evaluation is not something to fear, It is a tool for protection and prevention.